Hey everybody, this is Chad Campbell, a certified functional medicine provider with Redesign You and Hope Family Care, back to do our update that I told you I'd be here for. I want to thank everybody for all of their encouragement and their questions that they sent to me. I hope I was able to answer all of your questions. There's been a lot that's changed um, since the last time that we met, and some of the things we talked about we can no longer do as well. So I was excited to get back with you to go over some of that stuff. Today I'm actually at home sitting out in my wife's garden, um, just enjoying being outside. I haven't been able to do that for a while. Okay, so let's talk about the symptoms before we get into some of these new things. So if you remember the symptoms of COVID-2, COVID-19, coronavirus, however you're calling it, if you remember the symptoms of this, they range from completely asymptomatic now to the worst, intubated in the ICU. So what that means is there's a lot of people who have absolutely no symptoms walking around who have COVID-2 coronavirus. Um, when we remember that, that's going to start to play into this new thing that now, unfortunately, the young are starting to get sick. So there's now a high number of seriously ill and hospitalized people between ages of 20 and 40 years old now. It's actually, when you break the numbers down, um, half of hospitalized are under 54 years of age, and 30% are between ages 20 to 44. There's even now some under 19 years of age. Um, these ages under these 54 aren't the ones that are dying as much, but they're very sick. It's still unfortunate that the elderly and um, the immunocompromised people are the ones who seem to be passing away from this. So the other concern with this is that this is not what happened in China or Italy. It didn't affect the younger population like this in China and Italy. So is it because of all the mass testing in a couple of the states who have these drive-throughs? It can't be, because these are actually the hospitalized people. So this is very concerning, because they're not supposed to be getting this. One of the theories is could be because of smoking and vaping, because the way that this virus works, and going through what's called the pneumocytes in the lungs and then gets through what's called the ACE2, which is how this whole thing works, is that smoking upregulates that. So all of you smokers, or all of you vaping possibly, but all you smokers are upregulating what could increase your risk for this virus. That's concerning. So they're not sure if that's one of those things. But the new number is now that this COVID-2 version is killing 5 to 20 times more people than influenza. That's their number they're going to. This was overwhelming to me, because when this first came out, I was like, it's gonna be another flu, another virus, just like everything else, and they're blowing this out of proportion. The longer this is going, the more real it's actually becoming. And we don't want to live on this side where we're like totally extreme, staying away from everybody, where the end of the world is coming. But we don't want to turn our backs on this stuff either. So this new statistic, or this new finding, it's hitting the younger population, and 30% of those seriously ill and hospitalized between ages 20 and 44. And many asymptomatic people walking around. So this thing is also becoming very discouraging. In my own office, I know that people are, when they're calling, they're discouraged, and when they come in, they're discouraged because they need to be seen. They want to be seen. They want to be evaluated, and it's hard because you're wanting to see people, and you need to see people, but people are getting sick, and not health providers are getting sick, so they're not able to be there to help you to do it. In my office, we already have one provider who's out, and she's been out for a week. We're still waiting for the results to come back. And so we're down a provider in this. So in our office, what we've done is we have chronics coming in at a very specific time of the day, and then we have 5 hours in the evening, nighttime clinic, that we have certain protocols that sick people are able to come in. And if they meet certain criteria, they go through a different protocol: backdoor entrance, gloves, masks, the whole shebang for that. What's hard is that you keep being told, don't go to be checked out. Don't go anywhere. And I have a hard time with this because COVID-2 is not the only thing happening right now. So if you get an ear infection, you're getting a sinus infection, you get pneumonia from something else, you get the flu, your blood pressure's out of whack, you have diabetes that's not being under control, you have these different things. Don't negate your health. Don't turn your back to it. Call your provider's office. Find out what can we do to still make sure that I'm able to take care of myself and that we're still there to able to take care of you. We're doing a lot of telemedicine visits for this as well for people who qualify to be able to do that. But don't negate it. Call your doctor's office. Find out, are you doing things to separate me from those people who are being sick? And still take care of yourself. Still take care of yourself. Temperatures. Somebody had asked about how hot of a temperature. And I'm not sure if you're talking about foods, when you get food from somebody and then cooking it. But it's 140, 150 degrees for 15 minutes is what they found for SARS-CoV-1 to get rid of it. I'm not quite sure with this. Remember, it's acting different now, but that's the background of the COVID-1. But it's a little bit different because remember how it's attacking the young people, so we're not quite sure. That's going to throw a lot of mix into this whole thing. But remember, it does live on surfaces for up to 48 hours, and it can live in the air up to 6 hours. So if you really think about that, many people asymptomatic who have the virus can live on the surface up to 48 hours and can live in the air for up to 6 hours. So you have to think about that when you're trying to prevent this and trying to reduce the exposures of what you're being exposed to. As far as new treatments, there's still no set new treatments out there. And I'm not going to get into all of the different ones that they're testing, but they are looking at malaria medicines and HIV medicines and blood pressure medicines. There's all kinds of it out there, but nothing has been shown yet to be effective that they're looking for. A change from the last time that we did meet was where we talked about vitamin D. Now with vitamin D, they're saying it might actually upregulate this virus as well. So no vitamin A, no vitamin D, no elderberry, and definitely no NSAIDs, Motrin, Advil, ibuprofen, because it can increase what's called the cytokine storm, which is the huge inflammatory process in there. So stay away from those for sure. And just remember, it's all about the prevention. We're still talking about social distancing, 6-foot rule when you're with somebody, keeping your hands away from your face, as I just did, keeping your hands away from your face. You're hearing these things over and over again, but it's still about prevention. So one of the things, another big thing that pops up is this is, so what's so bad about this? We're going to get over it. And you're right. We're going to totally get over this. Right now, the assumption is about 18 months. It's going to be about 18 months to get over it, meaning that when it starts getting hot, at least here in the United States, when it starts getting hot, it's going to start to decrease. And then when it gets cold, it's going to come right back, just like how the flu does that. Still not sure. There's still theories of what could happen with this. The good news is that they say is once you're infected, you're immune. So once you're infected, you're not going to get it again. However, the change from hitting the younger people again is now, what does that mean? Is that gonna still be the case here? And we don't know. So to answer the question, are we gonna all get over this? We are. We're gonna get over this. How long is it gonna take? We don't know. Work the prevention. There are possible long-term complications. For those who developed SARS-1, developed this years ago, the 10-year study, what it showed was those people who developed this had much higher risk of cardiac and pulmonary disease. Meaning, if you get this virus 10 years down the road, you have higher cardiac and pulmonary disease rates than other people do. So that's concerning, because we know right now when you get the virus, it can cause an acute heart injury. It can cause these things, and can cause these myocarditis, inflammation in the heart attacks, things like that. But the 10-year study shows you have a higher risk of developing heart and lung disease down the road, even without that acute heart injury. That's a little concerning. And then vaccines keep coming up. With vaccines, you want to be super careful. You don't want to rush a vaccine. You have to be careful with the safety profiles on this. So my question first would be, if they just come out and say, hey, we've got a vaccine for you tomorrow, would you take it? Would you take the vaccine if they came up with a vaccine that fast? And most of the people that I know are going to say no, because many people don't get the flu vaccines, and they know what the flu can do. They know the possible increased risk of death and how many people get the flu, but they still don't get it. Same thing with this. Are you going to get it? Let's let them do their job with the safety profiles of these vaccines before we start requesting to give us these vaccines. That's my own personal opinion. Take it, throw it out the door, however you want to do it. The most hard, controversial thing is the testing. This is so difficult because so many people want to get tested. And like we talked about last time, the lab company is only sending us 5 kits per week. If we request them, sending us 5 kits per week for us to be able to test. And so we don't have, as a population, we don't have all this testing that we can do. So their current requirements for the CDC are, do they have the risks for this? So first, do they have fever, shortness of breath, chest tightness, plus exposure to COVID-19, exposure where they travel to China, or they live in congregate living, meaning nursing homes, or the new one, that they're high risk exposures because of, such as medical professionals. If they meet those, then they would do a flu swab first and strep. I even know of one reservation that is also doing Rocky Mountain spotted fever first. Then they will consider doing the COVID-19 test. To give an example, like of what I'm going through when the other night, we'll just say just the other night, when I had 3 possibles, three that were really thinking about wanting to get tested. They were. So one was a mom who came in with her son who had a cough, no fevers, nothing else. She called her employer and told them that her son was sick and she was going to stay home with him and keep him isolated. And they told her that if he was tested, then they would pay her time off to stay in isolation with him. However, if he didn't get tested, she had to take her sick time or vacation time, and she didn't have that. I couldn't test her. I couldn't test her because she didn't have the symptoms. He didn't have the symptoms. And I knew, I understood what she was saying, but if we can only theoretically send out 5 a week, I can't do it. The second one was a mom and son, both who had fevers and cough, and the mom had asthma. They both had a fever of 100.4 in the office. They had the symptoms, but when the mom and I were talking about this, I said, are you gonna go anywhere? Are you around anyone? She said, no, we are staying home. We're not going anywhere. So I didn't test them because it's not gonna change the outcome of what we were doing. She's gonna stay home in isolation anyways. However, I did tell them, if you're not getting better within 2 days, to let me know so we can get some lab work, because there are certain labs that we can do to try to lead us in this direction. Chest x-ray, in order to try to evaluate their progression. And within 2 days, they both were doing better. Chest x-rays are okay, CAT scans, it's just like this whole thing with this imaging thing. It's just right now, if you're not getting better within 2 days, we want to get a chest x-ray. The third one was a mom who came in with her son, again, fever of 101, I believe it was 101.4, coughing, sore throat, and single mom, single income household. She called her employer. They said that they didn't know what they would do yet. They still didn't have any protocols for them. And she didn't have the vacation time to do it. So I tested him. I tested him because if it comes back negative, then that mom can go back to work. So until that test comes back, they're in isolation at home. Just the 2 of them, cannot go anywhere. But when that test comes back negative, then she can go back to work to support her family. So this is what's so hard, because you're trying to make these decisions as a provider. And I know that the news channels and all these people are saying all this stuff, go get tested, get tested, get tested. But we don't have those resources in many places. So think about that when you think about getting tested, and if it's going to change what you're doing. If one of my staff starts getting sick with a fever and a cough, I'm probably going to test them, because we need them there helping all of these sick people. We need to know. They need to get back in there. We can't afford, our community can't afford for the medical professionals to not be available for 2 weeks for their chronic health, or if they just get sick, or if they develop this. So I don't know what the right answer is, but I do know that that's what our office is doing. And we feel that that's a proper way to do it. That's what we're at. The other big thing that comes out with all this is the whole psychological effects of this. We're going to go stir crazy. It's like, how do we stay connected? Social media is not a way for us to stay connected for a very long time. And we can't stay inside forever. We can't just isolate ourselves. People are sending me messages saying that I look tired. I know, and I am tired. I'm staying up, reading as much as I can, researching this as much as I can, because I need to know it to take care of our patients, our community, and protect my family, protect my staff, and to give advice and what are the most important things to everybody else so they can do the same. You can't rely on the news channels, and we can't rely on these people trying to make money off of this time. I get jobs. I get what we do for a living. But nobody understands this. And so again, I'm sorry, I'm gonna go on this kick again, but do not start buying things with people saying, I understand this virus. I know what it's going to do. You need to do these protocols, because some of those flu protocols that they're copying and pasting, or upper respiratory infection protocols that they're copying and pasting, can actually make this worse. It can upregulate that. So we don't know. Stick with the basics. Stick with the basics, the prevention, the anti-inflammatory diet, as far as your right eating, your sleeping, reducing the caffeine and the sugar, reducing the alcohol, okay? If you smoke, think about it again, because it's gonna upregulate that, and that's one of those things that can make this worse. So think about those things when you're thinking about how to prevent it. Don't buy plans that people say they can sell, okay? So with this whole isolation, we innately don't like to be isolated. We need community. We want to be around people. So when you start exploring, and you will, when you start exploring and getting out there, just think of all those possibilities. The whole living on surfaces for 48 hours, could be in the air for 6 hours, because many people are walking around who don't have symptoms. They are asymptomatic. So even though they don't have fevers and coughs, so they feel like they're safe, they may not be safe. And I've had people telling me, what do you think? If I don't have symptoms, I just want to ignore it. I don't want to get tested, because if I don't know, then I don't know. Like, oh, this is going to be this ethical issue that each of us go through. Because remember, we can love through smiling on our face. Your smile can do a lot. Can do a lot. One thing, I forgot one thing I wanted to tell everybody. Everybody, this toilet paper thing is just crazy, is that when this came out in the beginning in China, when this came out, 10% of the people that presented with this, they presented with GI symptoms only. So what happened was they went into an ER or to their provider, and they were admitted to the hospital for GI symptoms, nothing else, admitted to the hospital to the med-surg unit, and then, because nobody knew, they then transmitted this to many, many people. So actually 10% of those people actually had GI symptoms. Pretty wild. Anyways, so I'm going to continue to bring updates, continue to bring as much as I can as far as what is the stuff that we know, not what could be happening, but what we know. And next week, I'm going to be interviewing a good friend of mine. She's an integrative pediatrician who is also staying in the know with this. One of the problems is that she and I are so busy that we got to still pick a time, and so we're not going to be able to put it out there when that time is going to be. So my people told me that they put this on YouTube, and that if you click the links, then on YouTube you can hit subscribe and the bell, they said, and that when those videos come up, that you'll be notified. And then also that'll notify you when I'm bringing new updates about things that are changing, such as the things that have changed, like what we've talked about today. These things are changing so fast, and I will come on and do a video, even if it's just for 2 minutes or 5 minutes, if that's all it takes to bring you those updates, because I want you to have those updates. If you have any questions or comments, you can always send me those. We have a Facebook page, Redesign You, all one word, and you can message me through there, and just as a bunch of people did after our last video, and I will get right back with you and try to give you the best advice that I can, and is all that I know. No assumptions, just what I know from what the research is showing. So in all of this unknown time and all of these unknown answers, take the time to love your family. You know, you can't do anything about this. You just do your prevention, and you can't change what's happening. And there's no reason to start trying to figure out, did this come from conspiracy stuff? Did this come from somebody anti or some kind of war type of thing? Right now, reduce the stress. Reduce the stress in your family. Love each other. Take a walk together. Take this opportunity to spend time together without all the distractions of what we normally have. And remember, you can love amazing with your smile. Thanks.